This is the second part of oral contraceptives. In first part, we have discussed about the oral contraceptives types and mechanism of action. Let us summarize that. In oral contraceptives, we have seen combined pill, phased pill, progestin only pill, emergency pill, and their introduction. In mechanism of action, we have seen in different methods how to avoid conception. Now we discuss about adverse effects. Non-serious side effects. These side effects will occur frequently and disappear gradually, and there is no serious effects. They are nausea, vomiting, breakthrough bleeding, and breast discomfort. The side effects that appear later, they are weight gain, acne, increased body hair, koalosma, that is pigmentation of cheeks, nose, forehead, and pruritus vulvae, carbohydrate intolerance and precipitation of diabetes, mood swings, mental depression, abdominal distension. And the serious complications are leg vein thrombosis and pulmonary embolism, the coronary and cerebral thrombosis, resulting in myocardial ischemia or stroke. Actually, the estrogen will result in venous thromboembolism, and estrogen plus progesterone will result in arterial thromboembolism. So, the mechanisms involved in causing thromboembolism are increasing blood clotting factors and decreasing antithrombin 3 and decreasing plasminogen activator in endothelium, as well as increasing in the platelet aggregation. So let us summarize this page. The non-serious effects are nausea, vomiting, headache, breakthrough bleeding, breast discomfort, and side effects that appears later are weight gain, acne, increased body hair, koalosma, and pruritus vulvae, carbohydrate intolerance, precipitation of diabetes, mood swings, mental depression, and abdominal distension also. The serious complications are leg vein thrombosis and pulmonary embolism, and also coronary and cerebral thrombosis, which result in myocardial ischemia or stroke. The mechanisms involved in forming the thromboembolism are increasing blood clotting factors, decreasing antithrombin 3, decrease in plasminogen activator in endothelium, and increasing in platelet aggregation. So these all result in the formation of emboli. The next side effect is rise in BP. The estrogen and progestins increase plasma and angiotensinogen level, so that this will increase the renin activity. As we know that renin normally increases the blood pressure by vasoconstriction, and it also increases the aldosterone levels, so that it will increase the salt and water retention in our body. The salt which is absorbed reabsorbed into the our body will tend to raise the blood pressure, and this HDL by LDL ratio will be raised by estrogens, but progesterones will nullify it. And genital carcinoma, benign hepatomas, and gallstones are other side effects of these pills. The contraindications when we do not use these pills, that is called contraindication. The thromboembolic coronary cerebrovascular disease patients, we should not give these pills to them. Hypertension and hyperlipidemia patients, active liver diseases, malignancy of genitals or breast, porphyria, before surgery we should not give estrogen. Relative contraindications are diabetes mellitus, smoking, obesity, uterine leiomyoma, it is one type of cancer, migraine, hypertension, gallbladder diseases. So the other side effects are these one, that rise in BP, which increases the plasma angiotensinogen level, increased renin activity, so that increase in blood pressure, and HDL LDL ratio will also be nullified by progestins when taken with estrogens. And genital carcinoma, benign hepatomas, gallstones. The contraindications are thromboembolic coronary cerebrovascular disease, hypertension and hyperlipidemia, active liver diseases. So, as the side effect is hepatomas, and malignance of genitals, as carcinomas are produced, gallstones are produced, so that liver diseases, uh, porphyria, and malignancy of genitals. Before surgery, we should not take estrogens. And relative contraindications are diabetes mellitus, smoking, obesity, uterine leiomyoma, headache. Uh, as one of the side effect is headache, we should not use in migraine. Hypertension, as the already the side effect is increase in BP. So in hypertension, it will also increase much high BP. So in gallbladder diseases also, as it produces gallstones. The interactions of oral contraceptives, phenytoin and phenobarbital or enzyme induces, that means it will enhance the metabolism of oral contraceptives, so that blood levels of oral contraceptives will be decreased, and the effectiveness of oral contraceptives are also decreased by this. Tetracyclines and ampicillin, these antibiotics suppress the intestinal microflora, so that the deconjugation of estrogen in bile. Actually, during excretion, the toxic components are converted into non-toxic components by conjugation, so that here deconjugation of estrogen in bile does not occur, as the intestinal microflora is suppressed. um, and then the enterohepatic circulation is interrupted by this, so blood levels will be decreased. The other health benefits: low risk of developing endometrial and ovarian carcinoma. These are the um, these are the uses of other uses of oral contraceptives. Low risk of developing endometrial and ovarian carcinoma, um, reduced menstrual loss and associated anemia. Endometriosis and pelvic inflammatory disease tend to decrease. Okay, that's all for today.